I'd like to talk about COVID-19 pandemic and medical tourism market. In this presentation, I'd like to review the current COVID situations, and I'd like to deal with the impact of COVID on medical tourism market as well as travel industry. After reviewing the impact, I will forecast the medical tourism market. Based on this forecasting, I will suggest what actions need to be taken. Now let me explain the current COVID situations across the world. And this table shows the COVID situations in Asia. As you can see from this table, the number of cases and the mortality rates are relatively lower than Western countries. In this table describing the COVID situations in America, the number of cases and the mortality rates are relatively higher than those from Asian countries. In this table, the number of cases and the mortality rate of European countries are relatively higher than those from Asian countries. Overall, Asian countries outperform the Western countries in controlling the COVID pandemic. In my opinion, there are several reasons for this difference. First, because of the geographic proximity to China, many Asian countries took early preventive actions. Second, because of the past traumatic experience like SARS and MERS, many Asian countries are better prepared for outbreak. Third, public health safety was given higher priority over personal privacy. This led to active government intervention. Fourth, people complied with the preventive measures like wearing face masks. Now I'd like to explain the COVID challenges for travel industry. COVID-19 resulted in financial crisis across the countries. Most of the organizations projected minus growth rate. During COVID-19 pandemic, we have seen the silent rise of nationalism and the rise of telecommuting. Because of this COVID pandemic, most of the countries imposed travel restrictions. We are expecting the increase of travel cost. The UN World Tourism Organization estimates that international tourism could decline by up to 80% this year over 2019. We are expecting a decline in revenues from tourism. It will be around $910 billion to $1.2 trillion. Now let's talk about the COVID-19 challenges for medical tourism market. As you can see here, there are many stakeholders in this industry. The COVID-19 pandemic severely damaged those stakeholders. Because of the border shutdowns, medical tourists have been forced to cancel their travel plans. Patients at higher risk, like elderly patients or patients with underlying health conditions, would avoid going abroad for the time being. Let me talk about the impact of COVID-19 on medical tourism facilitators. Significant decrease in foreign patients has led to a dramatic decrease of revenues. Some medical tourism facilitators would go out of business. The healthcare providers would be exposed to the similar business risks. Some international clinics are laying off translators and medical tourism coordinators. This means that they are losing the competitiveness of business infrastructure. The fittest that will survive during COVID-19 pandemic will be in a better position in the market after COVID. Some healthcare providers heavily dependent on foreign patients may struggle or even close their international operations. Volgograd Hospital relied heavily on foreign patients hit particularly hard by the COVID-19 pandemic. Let me forecast the medical tourism market. The health tourism market, which indicates wellness tourism as well as medical tourism, would rebound through several phases. In the first phase, we will see the growth of domestic medical tourism market. In the second phase, there will be rebound of wellness tourism market. In the third phase, we'll see the geographic segmentation of medical tourism market. There will be three waves of returning patients to global medical tourism market after COVID-19. In the first wave, patients with urgent need and desperate need of advanced care would return to the market. In the second wave, patients with low perceived risk or need for low-risk procedure with little follow-up will come. In the third wave, patients who feel less safe and have many questions would return. There are several contingency factors in forecasting the market. Depending on the conditions of these factors, there could be a variation in the outcomes. Let me first talk about the short-term forecasting. In the short term, we'll see the shrinking market size. The market recovery by year 2021 or 2022 would be limited. COVID-19 debunked a myth about medical tourism leaders like US and other hospitals in European countries. There will be a market turbulence. And we'll see the growth of domestic medical tourism market. And the global medical tourism market would rebound with the short distance travel market. Shrinking market size. We'll see the decline of medical tourists and the decrease of medical tourism facilitators, and also the decrease of healthcare providers in this global competition. There will be a downward pressure in the market, decrease of medical tourists. Elderly patients should be quite reluctant to go abroad for treatment. Patients with underlying health conditions like respiratory diseases would avoid going abroad. Patients for elective procedures would delay their travel plan. However, there will be an increasing demand from a certain section of medical tourists. Patients from countries with a dysfunctional healthcare system during COVID-19 pandemic will look for the services in other countries. There will be a growth of domestic medical tourism market. After COVID-19 pandemic, domestic medical tourism will precede international medical tourism. The rebound of domestic medical tourism market would be stronger in the countries which successfully dealt with the COVID pandemic or were less overloaded with cases. There will be rebound of wellness tourism market. After COVID-19 pandemic, there will be a significant shift towards wellness services. People are concerned for marginal immune response to COVID-19. They suffer the COVID-related stress. So there will be an increasing interest in well-being. People may be interested in boosting immune system, and they may look for relaxation. There will be a geographic segmentation of medical tourism market. Because people would avoid long distance travel, short distance travel market would rebound strongly. There is a relevant concept, travel bubble. Travel bubble means a set of countries agree to open their borders to each other. So we have already seen several countries are planning to use this concept, travel bubble. They want to still keep developing their tourism industry. So their short-term strategy is to use this travel bubble concept. They want to open their borders to the other countries which successfully control the COVID-19. Let me talk about the short-term impact of COVID-19 on travel industry. Touchless travel will be the dominant form of travel. Hiking and backpacking will gain popularity. And people would be interested in these keywords like safety, privacy, wellness. Let me explain the long-term forecast. We'll see the improvement of destination brand competitiveness of Asian countries. Digital connectedness will be a key concept in the travel market. Asian countries will gain competitive advantage in global medical tourism market. There will be a chance for Asian competitors to gain the strong presence in Arab and CIS market. Countries with well-developed ICT infrastructure and technical readiness will gain competitive advantage in global medical tourism market. Telehealth will gain its popularity. Many countries will try to adopt this telehealth to promote its competitiveness in the global healthcare market. In the long term, we'll see the restructuring of medical tourism facilitators. Medical tourists are seeking out new ways to connect, from informal network to online platform. Some medical tourism facilitators, which are based on the online platform business model, would gain competitive advantage over others after COVID-19 pandemic. The long-term effect of COVID-19 on travel industry would be the appearance of digital travelers. The travel industry should be ready to handle these digital travelers. Now let's talk about what actions need to be taken. First, This is a time for critical reflection. We have pursued relentlessly for increasing the number of medical tourists since this was the gold standard for evaluating the achievement of a government-driven project. We have been overwhelmed by quantitative performance indicators. So I think this is the moment for critical reviews. We need to look at our mistakes, like malpractice, privatizations, or ethical issues. I think this is a valuable moment to reflect on what might be good going forward. Second, we need to concentrate on innovating customer services. We need to develop the protocols for the new normal. We need to focus on organizational preparedness. We need to develop capability to screen patients for COVID-19 symptoms. We need to develop guidelines of a safe experience for medical tourists. We need to adopt touchless interface technology to provide better services and safe services to the medical tourist. And digital service delivery will emerge as the keyword in the future. Many world-leading hospitals have already adopted telemedicine services. We should try to improve the virtual experience of medical tourists. We need to develop digital value-added services like advice and education online. Third, we need to make a plan for gradual lockdown easing. From South Korean perspective, we may collaborate with these countries to try a travel bubble. We also need to make an entry management protocol for medical tourists. Fourth, we need to identify and improve infrastructure for product development. We should concentrate on developing product portfolio. In this medical wellness tourism market, there are medical services, wellness services, and tourism resources. By combining these three sets of services, we should try to create a unique and attractive product. This table shows the examples. Medical services can be classified into these categories like anti-aging services like cosmetic surgery, dermatology, oriental medicine service, health exam, and the treatment for mild diseases and the treatment for severe diseases. And wellness services, skincare, meditation, spa, massage, healing foods, and nature and forest. And in tourism resources, we should try to improve these infrastructures, residence hotel, guest for patients and family members, and restaurants and marts for different religious or ethnic groups, and shopping mall. And we also should try to develop something unique to enjoy. And we also should try to develop the concierge services and transportations. And fifth, we need to focus on branding and marketing during COVID-19 pandemic. We need more creative approach. Destination branding, we should keep asking the following questions. What is the market perceptions of destination? What is your unique sales proposition? How to formulate the identity of place? How to communicate with the customers? We should send this strong message. Our destination, our place is safe, and we provide the value-added services. And there are several marketing channels, emails, websites. However, these days, many potential customers, they prefer SNS. So we should try to share content with the with the goal of retention, staying in touch with existing customers and helping them. And we can also try to host virtual and hybrid conference. Mm, Marketing message. We need to create the appropriate message during COVID-19 pandemic. The message should be sympathetic and assuring. These are the few examples. The key message should be we care for you. So these are the examples. We are here to support you in any way we can. As a valued customer, you are our priority, our pledge to you. As the components of message, alertness, alert message, and empathy, entertainment should be included. We should try information sharing with the customers. There are practical tips for COVID-19 prevention. We can also develop protocols and regulations to fight against the COVID-19. We can share these informations with our customers. Marketing execution style. There are several different styles. Announcement, association, transfer, lessons, like direct communication, drama, entertainment, imagination, cartoons and film, and video techniques. These days, branded videos and motion graphics and cartoons are popular, especially during COVID pandemic time. So I have briefly reviewed uh, the current situations of COVID, and I try to forecast what will happen in the future. And then I try to suggest some strategies and actions which should be taken during this pandemic period. Thank you for listening.